So, you're scheduled for a joint replacement, and you know that wait can feel, well, pretty tough. But what if that time wasn't just about waiting around? What if it was actually your secret weapon for a faster, better recovery? Today, we are going to break down exactly how to turn that waiting period into your single biggest advantage.
You've got the date circled on the calendar, but it's weeks, maybe even months away. And in the meantime, the pain is real. And let's be honest, the uncertainty can be super stressful. So the big question is, what do you do with this time? Do you just sit back and wait it out? Or is there a way to actively take control of the situation?
Okay, here's our game plan. We're going to start with the challenge of waiting itself, then dive into how to control your pain, stay safe from falls, and get everything prepped for your surgery. And then we'll see how all of that work pays off on the path to recovery.
Look, it is completely normal to feel anxious or frustrated during this time, but we're going to flip that perspective on its head. This isn't just waiting. It's something experts call prehabilitation. It's your chance to get your body and your mind in the absolute best shape for what's coming. And get this, research actually shows this can lead to shorter hospital stays and a way faster return to your normal life.
I want you to really think about this for a second. Every single thing you do right now directly impacts how well you're going to heal later. You're not just a passenger here. You are an active player in your own success story. And that whole story, it starts today. So where do we start? Well, let's tackle the most immediate issue, the pain. Drawing on some guidance from the National Center for Biotechnology Information, let's look at some really practical strategies you can start using right away to manage that discomfort while you wait. There are basically two main paths to managing pain. Now, the medication your doctor prescribes is, of course, absolutely essential. You follow their advice. But our focus here is going to be on the non-pharmacological side. We're talking about the things you can actively do every single day to make a real, tangible difference in how you feel. And here's where you can really take the wheel. First up, gentle, low-impact exercises like swimming or cycling. They strengthen the muscles around your joint without actually stressing it. Then there's weight management. Even losing a few pounds can take a huge load off that joint with every step you take. Using a cane or a walker? That's not a weakness. It's a smart move for stability and relief. And hey, never underestimate the simple power of a good old-fashioned heat pack or a cold compress. Next, let's talk about protecting yourself. This is so important. A fall before your surgery can cause serious complications. It could even delay your procedure. Making your home environment safer isn't just a nice idea, it's a critical, non-negotiable part of your prep. This number right here, it's kind of staggering. According to the CDC, 1 in 4 older adults falls each year. And when your mobility is already a bit shaky because of joint pain, that risk is even higher. Now, this isn't about being scared, it's about being smart, aware, and taking a few simple preventative steps. The good news is, prevention can be surprisingly easy. Just take a walk through your home and look for these common hazards. Tossing a throw rug, adding a nightlight in the hallway, or just tucking away some electrical cords. These are tiny changes that give you a huge safety boost. All right, for our final pillar of preparation, let's get down to the nitty-gritty, the logistics. Getting all the practical details sorted out ahead of time, following some great guidelines from the American Academy of Orthopedic Surgeons, is going to make the days around your surgery so much calmer and way less stressful. Breaking it down like this just makes it all feel so manageable. 4 weeks out, call up that friend or family member who can help you out at home. 2 weeks out, have a little cooking session and stock your freezer. The week before, lock in your ride. Trust me, this kind of proactive planning is a gift to your future, less stressed self. You're probably going to hear this term, medical clearance. Sounds a little intimidating, right? But don't let it worry you. It's just a standard safety check. Your primary doctor will run a few tests to make sure your body is totally ready for the procedure. It's all about ensuring the safest possible outcome for you. It's a routine, and honestly, a very vital part of the whole process. So when you put all this preparation together, what do you get? You get a powerful head start. By the time you actually head to the hospital, you're going to be stronger, safer, and way more organized. You've literally paved the way for a better recovery by turning what could have been a passive wait into a period of active preparation. If you remember anything, remember this simple framework. These are your 3 pillars for success. Number 1, manage your pain with proactive strategies. Number 2, prevent falls by making your home safer. And number 3, prepare logistically to slash that stress. That's it. That's the core of it all. At the end of the day, this journey is yours, and the power to really influence its outcome is in your hands right now. You're not just waiting for surgery anymore. You are actively preparing for a brand new chapter of mobility and life. So the only question left is, how are you going to use this time to give yourself the very best head start on healing?